come to order. I want to thank our staff for working so hard as they have over the last 2 or 3 weeks to put things together so we're where we are now. I'm going to give my opening statement, and then Senator Wyden's going to give his opening statement, and then I'll give some agenda items, and we'll have then opening statements from members. And I think we'll do it the same way we do opening statements. We'll do it by people they're coming here in order of attendance. In 2003, when we first passed the Medicare Modernization Act, I was chairman of the committee and had a big part in putting that program together. And it's one of the things that I'm proud of. At that time, our goal was to make the first improvements in Medicare program in nearly 40 years. We wanted to give seniors an affordable option that worked like the health insurance they had in places from where they retired. We wanted to make sure that legislation benefited all seniors, and we put into place a mechanism to keep the price drugs down. Part D, private insurers negotiate with drug manufacturers to get the best price on drugs so that premiums stay affordable. That has worked well. Premiums in Part D program have been remarkably stable since the program's inception, despite claims from naysayers at that time that premiums would skyrocket. So we should keep what's working and fix what we can improve. In the 15 years since the last major reform of Medicare, we've seen the development of innovative medicines to treat arthritis, cancer, and I'll just simply say countless other disorders rather than making a long list. These treatments have been life-saving or life-changing for millions of Americans. But of course, they have come with increased costs. This includes increased out-of-pocket costs for beneficiaries, increased taxpayer spending. Now, all of us on this committee have heard from our constituents about the high cost of prescription drugs, or we probably wouldn't be here dealing with this legislation. And I'm sure the president heard it because 13 months ago, he made a commitment to lower the cost of drugs. I've heard from Iowans who have left prescriptions at the pharmacy counter or have skipped doses of their medicine to save money. You all remember in our first hearing that we held this year, we heard from a mother whose son reduced his insulin use because he was concerned about the financial burden placed on his family by the cost. You even heard of a person dying as a result of that. So going back to the beginning of this year, not only with what I anticipated doing in this committee, and at that time I met with Ranking Member Wyden on this issue. We both met with Senator Alexander and Senator Murray of the other committee that deals with health issues. We wanted to head in the direction that Senator Alexander's committee proved 2 weeks ago, where they wanted to go, and they had a successful product out of their committee. I hope today we're still headed in that direction and we can get a successful product out of this committee so we can have joint efforts on the floor of the House to accomplish the goals that we sought way back in January. So, getting back to the beginning of this year, I said that addressing high drug prices was one of my top priorities. I also said that any effort to tackle such a problem needed to be bipartisan, go through regular order and be marked up before the August work period. And let me emphasize that bipartisan approach, because everybody, whether you're a new member of the Senate or an older member of the Senate, you know nothing gets done in this body unless it's bipartisan. So I want to thank the senators on this committee who I've worked with to craft this bipartisan bill. We have a bill before us that addresses high and rising prescription drug prices, again, emphasizing in a bipartisan manner. At last count, there are over 24 proposals in the legislation that are supported by at least one Republican and one Democrat on the committee. We've included many of our member priorities in the bill. Today, we will consider legislation that will improve Medicare Part D by bringing the payment system up to date with therapies that are now available. We do this by capping out-of-pocket expenses for seniors and people with disabilities, by permanently closing the donut hole, by keeping premiums from increasing, and using taxpayers' dollars more efficiently. In Part B, we are shifting the perverse incentives towards the use of less expensive but equally effective medications. We also want to manage the costs to the taxpayers. We want more transparency about what goes into the drug price, including information from manufacturers and middlemen such as pharmacy benefit managers. Now, getting to the agency that is God around Capitol Hill, CBO, and if you wonder whether CBO's God here on Capitol Hill, just try to get something done when they give you a figure and you got to have 60 votes to override it in the United States Senate. What they say, right or wrong, is very powerful. This is what CBO says. This bill will save taxpayers more than $100 billion, lower premiums, lower out-of-pocket expenses for Medicare beneficiaries, and provide peace of mind to millions of seniors who will never have to worry about going bankrupt to pay medication. And I just realized something. My voice is rising, I'm yelling, I'm not mad at anybody. Now here's an added benefit.
You're just being Chuck Grassley.
Okay, thank you. Now here's an added benefit, again by the God on Capitol Hill. It will even help lower costs in the commercial market. Now, put that all together, this should be a win for all Americans. To the naysayers who claim our bill contains price controls, and this is the most vexing problem that Senator Wyden and I had to deal with. He's got people on his side of the aisle, isn't satisfied with what we're doing, and I've obviously got people on my side of the aisle that isn't satisfied with what we're doing, and I think it all boils down to this one issue. But to these naysayers who claim that our bill contains price controls, I want to submit for the record, and it'll be included unless there's objection, an analysis by the conservative economist Ovik Roy, who does a good job of rebutting that argument. Now, my second comment is about proposals to tie U.S. drug prices to international prices. I have a couple of serious concerns about the proposal. First of all, we don't know much about what they are or how they work. Secondly, I worry that one, unintended consequences could be the loss of innovation. Now, this is the moment for the Senate to act. We have jurisdiction over all Medicare and Medicaid. So what we do here today really matters, really matters. Not only politically when you hear about this from our constituents, but to all the people that are affected by these programs, real people. Now, before we move on, I'm going to ask Senator Wyden if he'll pay attention. A special point of thanking Senator, our ranking member, for his cooperation. He's been a good partner. That said, I want to point out something that the administration threw at us, kind of a curveball a couple weeks ago when they did not finalize a proposed rule. That rule would have ensured that the savings from rebates in the Part D program would be passed through to benefit seniors at the pharmacy counter. It happens that I believe that's a very good idea. So, Senator Wyden, I'd like to continue to work with you to get a similar policy into our legislation before it becomes law. I would also like to address the unfair clawback practices that affect pharmacists who are trying to take care of their patients. So this is my request that in the same spirit we've worked on so far, I'd like to ask if you would agree to work with me on that issue as well.
Mr. Chairman, I will certainly be working with you on it, and I'm going to have some brief remarks on this last point that you've made, colleagues. It involves what's called the point of sale rebate, and I'll have some remarks with respect to this after the closing of my opening statement.
Okay. Now, I'm just about done with my opening statement and then go to Senator Wyden. I happen to feel that when 61% of the Republicans in a poll say that the high costs of medicine is a very important issue to them, and they even, that 61% even want to go as far as doing away with the non-interference clause. And then we hear from people of all colors about this, that the only option for us to do is to act now. The American people are counting on us. This is the time to decide if we actually want to reduce drug prices for people or just give the problem lip service. I'll add one other thing, and that is that we all know around this audience, not only on this committee, but all of Congress knows this, what's bad situation Medicare and Social Security's in, and we all know it takes a bipartisan effort to get anything done in these areas, and we all know something needs to be done. And if we can't do something just on a small part of this issue with prescription drugs in a bipartisan manner, how are we ever going to get the bipartisan cooperation it takes to deal with the problems that we all know dealing with the longevity of Medicare and Social Security? Senator White.